Classical homeopaths practice the original and traditional homeopathy of Dr. Samuel Hahnemann, the founder. So I will from time to time stress the classical in homeopathy. Homeopathy is a profound but exacting science. It may seem complicated at first, but it has quite a logical application when it is understood. Unfortunately, many people who have studied homeopathy and even practiced it still do not understand exactly how it works. It's simple, but it's profound. And this message gets lost as various teachers and students have passed their mistakes on. Let me explain. During World War II, a joke went round about a battle. It doesn't matter whose side it was about, but the joke went like this. The soldiers on the front line of a battle were coming under attack, a bad attack. These soldiers had had orders to take a hill, but they couldn't. The enemy was too strong. The soldiers badly needed reinforcements to win the battle. They only had days left, so they sent out an urgent message. Send reinforcements, we are going to advance. Send reinforcements, we are going to advance. This written message was carried from the front line to the nearest village. From there, it was relayed to the underground resistance movement in the next town. It was passed from underground resistance movement to underground resistance movement by various means. Finally, it arrived at its destination, the War Office. The corporal handed the urgent message to the general. It read, "Send 3 and 4pence. We are going to advance." Anyway, this evening, I hope I can deliver the original message about classical homeopathy. My brief explanation will help you, I'm sure, to understand how to recognize a traditional homeopath and avoid disappointment in homeopathy. You will come to understand unfamiliar words if you're not familiar with homeopathy. Unfamiliar words for many people, but familiar to those who've benefited from classical homeopathy. Words that are pregnant with meaning. Words like vital force, similimum, minimum dose, single remedy, levels of health. And the truly homeopathic remedy is also pregnant with energy for the lucky recipient.
It's a recording for this.
How can homeopathy regenerate, you ask? I will explain. In a nutshell, we are basically energy. We generate energy all the time to a greater or lesser extent. Of course, this depends on our age and health, but with stresses from various sources, this energy can become depleted. Stress can come, for example, from excessive or prolonged emotional or mental trauma, or excessive or prolonged medical or recreational drugs. These can deplete our natural allotted energy. But these influences are also part of life's rich pattern. However, should our lifespan's worth of energy be depleted, we may become sick for short or long periods. Short periods are known as acute illness. Long periods are known as chronic illness. And this is where homeopathy can help pick you up. Generally speaking, homeopaths view symptoms as an expression of the vital force attempting to heal itself. Vital force. What, you may ask, is the vital force? Such old-fashioned words. I will quote from one of the foundation books for homeopaths. It is known as the Organon, 6th edition, as some of you will recognize, was written in the 19th century by Samuel Hahnemann. Hahnemann, as I said, was the founder of homeopathy. This text, known as Aphorism 9, is very familiar to homeopaths. In the healthy condition of man, the spiritual vital force, autocracy, the dynamics that animates the material body, organism, rules with unbounded sway and retains all the parts of the organism in admirable, harmonious, vital operation as regards both sensations and functions, so that our indwelling, reason-gifted mind can freely employ this living, healthy instrument for the higher purposes of our existence. This is important. I will repeat it. In the healthy condition of man, the spiritual vital force, autocracy, the dynamics that animates the material body, organism, rules with unbounded sway and retains all the parts of the organism in admirable, harmonious, vital operation as regards both sensations and functions, so that our indwelling, reason-gifted mind can freely employ this living, healthy instrument for the higher purposes of our existence. So, without a vital force, without this autocracy or energy, we no longer exist. To counteract the depletion of energy, the loss of strength, the exactly matching remedy enables the organism to heal itself. An exact match is known as the homeopathic remedy. This is also known as the simillimum. Thus, a homeopathic remedy can encourage a struggling vital force to take up that extra bit of energy to heal. Energy that has been extracted from the world of nature. And all that is needed is a very minimum dose. This healing, by the way, all depends on the person's age and level of health. But more about that later. Simillimum. So what is a simillimum right here? If you're new to homeopathy, you may not have come across the Latin phrase similia similibus curantur. This phrase means like cures like. This is an ancient method of healing, advocated by Hippocrates, the father of medicine. Prescribing the right homeopathic remedy, the simillimum, is important if you want a successful outcome or cure. Let's look at what this means. The first prerequisite is a potentized remedy. Potent energy. This is where we might say matter is taken back to its primal state of energy. I have used the term energy because energy is what the recipient of a homeopathic remedy experiences when they have faith in their simillimum. And it is energy that comprises the primal state of matter. There are a variety of ways of making a homeopathic medicine. For example, a medicinal material is selected and crushed. Then it is diluted in water. And then the container is shaken over and over again. After many repetitions of diluting and shaking, there appears to be none of the original material left. That is to say, there is not much left that can be detected by the common scientific means. But there definitely is evidence when various sophisticated scientific instruments are used. This is a fascinating subject. If you would like to know more, let me know. However, one thing remaining is intrinsic energy. This energy is inherent in all forms. For example, Energy is found all over the animal, vegetable, and mineral realms. Energy is in poisonous substances. Energy then is inherent within everything, in what your senses can perceive and in what your senses cannot perceive. And this energy is brought to light, so to speak, during the course of homeopathic provings. The empirical evidence that energy is latent in matter is clearly shown during provings. For instance, after a potentized remedy has been given to healthy volunteers, a variety of symptoms on the mental, emotional, and physical levels may surface. These symptoms depend on the prover's susceptibilities. For example, the remedy arsenicum album may produce anxieties for some provers, while the remedy ignatia may produce hysteria in some, or the remedy mercurius may produce an ulcerated throat for others. All these notes are published as a materia medica. A practicing homeopath gets information about a remedy from their materia medica books, which are catalogues of the provings of single remedies. The second prerequisite of similia similibus curenta is to choose a potentized remedy to match the symptoms of the ill individual. The symptoms of a remedy from the materia medica should match closely the symptoms of the patient. I will simplify the explanation. If the match is right, there will be a change in the person's overall energy on the mental, emotional, or physical level. This will often be followed by an amelioration of their symptoms. Much like an oscilloscope, two similar frequencies brought together will cancel each other out. Remember, homeopathy does not treat diseases per se, but addresses the individual and their symptoms. Of course, the outcome of prescribing a homeopathic remedy will be dependent on the patient's overall general health. So, based on an individual's unique mental, emotional, and physical symptomology, a homeopath will match the most appropriate homeopathic remedy in order to stimulate the patient's innate healing abilities, their vital force, their energy. But not just any remedy will do. It must be as close a match as possible. The best success stories of homeopathic cures are due to exact or very close matches. Thus, homeopathic remedies are prescribed according to what is known as the law of similars. Of course, the reaction after the potentized remedy has been given will differ. This will depend on factors like the individual's energy level, general health, medical history, surgery, vaccinations, and so on. A strong vitality with vivid symptoms, as seen in healthy child, will generate a strong curative response. A weaker vitality with indefinite symptoms may respond slowly to their similar remedy. In a best case scenario, the presenting symptoms of the patient may briefly be enhanced at first, sometimes called an aggravation, before they are ameliorated. Or there may be just a gradual improvement in the individual's well-being and energy as their symptoms steadily diminish. The minimum dose. What is this about a minimum dose? Newcomers to homeopathy may wonder what the phrase minimum dose means. A homeopathic remedy only needs to be a very minimum dose because it contains intrinsic energy. This energy is released from repeated dilutions and succussions. It becomes, in effect, medicinal energy. So, only one application, one initial stimulus of the similimum is usually enough to start the vital force's movement towards curing itself. Much like rolling a ball, the curative effect can be profound. This is because the intrinsic energy in a potentized remedy can cover many, many symptoms. This similimum may gradually and gently heal many layers of disease over time. The greatest exponent of a minimum dose in homeopathy was its founder, Hahnemann. Hahnemann was appalled at the sufferings and deaths of so many patients. The physicians of his day heroically tried to heal patients with high doses of medicinal substances. So Hahnemann experimented with smaller and smaller doses of single medicines in order to minimize the side effects. And he developed a new method of dilution and a vigorous shaking of the substance called percussion. The resulting product he called a potentized remedy. Again, Hahnemann found that not only did he have a remedy without any side effects, but also that the more he diluted it with succussion, the better his remedy cured. Succussion released the energy inherent in the substance, with none of the toxic effects. He then numbered the remedies according to the number of times they had been diluted. The sequential dilution of the substance, along with succussion, is known as potentization. Classical homeopathy involves treating an individual with extremely dilute substances. These are usually in saccharum lactose tablet form, milk sugar. The aim is to trigger a person's natural healing abilities. Above the homeopathic potency of 6C, there is nothing physical left of the original material, only what appears to be its intrinsic energy. It is only a matter of time before science develops the technology to accurately measure the inherent energy within potentized remedies. And as science advances and curiosity grows about homeopathy, the homeopath's minimum dose will reveal that an infinitesimal amount contains much healing power. For acute or short-acting illnesses, and most first aid prescribing, the 30C potency is recommended. This is within the low potency range. However, if you're consulting a classical homeopath, the potency chosen and the dosage will be tailored according to your specific requirements. This is because the homeopathic medicines are so infinitesimally dilute, they will act according to your biophysical or energetic paradigm. Your own personal biophysical or energetic paradigm. And only an extremely minute dose is needed to encourage the vital force to start healing itself. The single remedy. With homeopathic remedies prescribed in a classical manner, only one single remedy is given at any one time. This is because, with the stimulus of one dose of energy, it is only necessary to use one homeopathic pill or one drop. There is more than enough to encourage the vital force to start healing. Because homeopathic remedies are usually proven singly at a time, they are usually prescribed singly at a time. The reason is that if two or more different remedies are taken at the same time, or an unproven combination remedy is taken, a homeopath cannot accurately ascertain which of the remedies has been the active ingredient, either positively or negatively, and some remedies antidote one another. However, there are always exceptions. For various medicinal reasons, some remedies have been combined before dilution and suppussion. However, these remedies have gone through the potentization procedure simultaneously from their material beginning, and have therefore been proven as one remedy. In approving, a single homeopathic remedy usually produces a plethora of symptoms on the mental, emotional, and physical level. This means that one single remedy can rebalance a sick person's whole dynamic system, including symptoms on their mental, emotional, and physical levels. Even if the symptoms of the ill person are localized, it is the person's whole system that has lost equilibrium. They are, in effect, trying to regulate themselves, trying to find balance through their symptoms. So, as a rule, not only physical but also mental or emotional symptoms are taken into consideration. These symptoms are all evidence of a unified effort to resolve an inner disturbance. Thus, in prescribing homeopathic remedies, only one single remedy is taken at a time, followed by observation of its effect on the person's energy. By waiting and observing, one can see the single familiar remedy activate change. Levels of health. I will now explain about levels of health. And this groundbreaking concept would be of special interest to doctors and medical practitioners. Professor George Brickautas briefly mentions the foundations for the levels of health in his book, The Science of Homeopathy, published in 1977. After nearly 60 years of experience and observation in his practice, he presented this fully developed practical theory for application in everyday practice. All the classical homeopaths who have trained with him use the levels of health. The book Levels of Health is an original contribution to homeopathy and the medical field as a whole. George Brickautas explains his concept of the 12 levels of health in detail, elaborating on the indications to which level the patient belongs. He explains the possible reactions of an organism's defense mechanism to homeopathic treatment, as well as what the reactions indicate. And this is very important. From the rarely seen extremely healthy person, who would be level 1, to the extremely ill person at the end of their life, a level 12. And all the other levels that we all fall into during the course of our lives. This fascinating book provides formulas for the physician to recognize whether a patient is improving after the prescribed remedy, as well as their prognosis. It also gives invaluable advice to the practitioner for assessing the gravity and severity of cases. In short, it supplies common sense guidance in case management. This knowledge helps avoid wrong prescribing and false hope for practitioner and patient alike. Acute or chronic illness. If you're unsure about the difference between an acute illness and a chronic illness, an analogy may be drawn from nature. Think of a tree. The leaves of a tree may be likened to the acute manifestations of illness. And while each leaf could well identify a tree, if you removed a leaf, another leaf would grow back again later. This is much like acute illnesses that keep appearing even after you think they're gone. However, a complete tree, seen from a distance, can be identified from its overall being, not just its leaves. The tree then may be likened to a chronic manifestation of illness: leaves, branches, trunk, and root. And a classical homeopath can see the difference between acute and chronic illness in much the same way as a gardener may recognize a tree from its overall being. And just as a leaf may identify a tree, an acute remedy may also be a chronic remedy. An experienced homeopath will know the difference. Therefore, for long-term chronic illness, or illness that hasn't improved with conventional allopathic treatment, it is advisable to see an experienced classical homeopath, someone you feel comfortable with. Don't treat yourself with homeopathic remedies for chronic conditions. Practitioners with specifically trained objectivity to analyze your case have taken many years to learn the science and art of practicing traditional homeopathy. They will know how to treat you safely and gently. With some of the more serious chronic illnesses, dedicated classical homeopaths can work alongside your other medical professionals. Integrate. A classical homeopath's specialized knowledge of prescribing will be invaluable in returning you gently back to health, or at the very least, alleviating your symptoms. Depending on the length and severity of your chronic illness, improvement in your general health may take time. Dr. Constantine Herring, and some of the homeopaths here will recognize his name. He was also called the American father of homeopathy, revealed what was later known as Herring's law of cure. This is an astute observation of the process of cure, whereby, during healing, a disease will move from the top downwards, from the inside to the outside of the body, and from more important organs to less important organs. For instance, it is quite common in homeopathic records that a patient being treated with homeopathy for asthma may find their asthma decreasing in severity or even disappearing, while eczema reappears on their skin. This is a curative response on the part of their immune system, moving the disease from their respiratory system outwards onto their skin. Homeopaths have often seen illnesses leave more serious organs to later appear on less serious organs, like the skin or mucous membrane, in the form of rashes, discharges, etc. So, give it time. Health benefits in chronic illness have been known to occur after only a few months' treatment with homeopathy. But of course, how long improvement takes depends a great deal on the duration of the illness, the general level of health, and the medical history. So it is unethical to give assurances on the outcome of homeopathic treatment. However, homeopathy is a non-suppressive, natural method of medicine which may assist those with chronic ill health to improve their condition. Research in homeopathy. You may ask yourself, is there any good scientific research in homeopathy? After all, that is what is done with conventional medicine. Well, yes, there is. And for the serious researcher, a significant quantity of credible and positive experimental studies for homeopathy at molecular, cellular, and clinical levels are available. It should be stressed that homeopathy does not treat diseases, whatever the diseases may be called. Homeopathy treats diseased individuals. It is an individualized medicine. Therefore, every case may need a different remedy, even though the persons involved are suffering with the same diagnosed pathology. In homeopathy research, this rule has been violated by almost all trials in all the meta-analyses, even in those trials that were called classical. An exception was the trials that attempted to be closer to the idea of the homeopathic principles as well. These trials showed excellent results in spite of the fact they did not follow a process of complete individualization of the cases. Homeopathy demands individualization of the cases in order to show its best therapeutic effect. Research should take into consideration the length of time and the severity of the case. The prognosis of a chronic condition, the possible time after which an amelioration sets in through homeopathic treatment, differs according to the length of time the disease is active and the severity of the case. It is important to note that most of the papers published on homeopathic trials till today are confused and confusing. In homeopathy, there is no such thing as giving a remedy for a specific ailment or disease. The idea of double-blind research is valid for conventional medicine, but not for homeopathy, which is based on the principle of giving a remedy for a totality of symptoms on an individual, and not only for his single ailment, disease, or pathology. I have quoted liberally here from Professor Vitkovic's website, by the way. However, good scientific research is to be found. If this edge is not clear for you, it is also on my Facebook profile as well. For instance, At the Keystone Symposium on Molecular and Cellular Biology in Vancouver, Canada in April 2019. Here, a presentation by Drs. Seema Mahesh Malata, and George Vitautas was presented by Dr. Veronica Jamelka. It was called Correlation Between Acute and Chronic Inflammatory States, a retrospective evaluation of 544 diabetes mellitus cases. And this is very interesting information for those who are suffering with long-term chronic debilitating illness. The aim of this presentation was the detection of a pattern between the occurrence of acute and chronic inflammatory states in these 544 people with diabetes mellitus. The research included 233 women and 311 men with an average age of around 54. The top 10 most frequent diseases in the past history were, and I'll list them: allergic rhinitis, bronchitis, tonsillitis, dermatitis, recurrent UTI, anal fistula, hemorrhoids, TB, appendicitis, renal calculi, fibroid uterus, hypertension, and typhoid. 81% of the patients reported no fever for over 10 years, and 89% had no fever after the onset of diabetes mellitus. So they were without any fever at all. The top 10 most frequent comorbidities were, these are the top 10 most frequent comorbidities. I'll list them: hypertension, allergic rhinitis, bronchitis, arthritis, gangrene, diabetic foot, non-healing ulcer, chronic fatigue syndrome, hypothyroidism, vitiligo, cancers, APD, GERD, heart complaints. One 197 cases had a follow-up. Just over 6 months. Now this is interesting. 36% developed acute diseases with individualized therapy. Now they had their similar, in other words. And of these, 58% improved in their general condition after the return of acute diseases. 56 cases had mental emotional issues, but a whopping 63% improved greatly after the return of acute states. This research showed that there may be a connection between suppressed acute inflammation and development of chronic disease. I will repeat, there may be a connection between suppressed acute inflammation and development of chronic disease. A very interesting point is that with complete improvement in the chronic, the original acute inflammation reappears. This is the amazing action of the similimate, the truly homeopathic remedy. So good scientific research into the effectiveness of homeopathy is ongoing and improving year by year. If you're interested in exploring this exciting world of research in homeopathy, please see the link I've posted in the chat room. I will post it again at the end of my talk. Is causation important? The causation of a disease is very important to the classical homeopath. Homeopaths are like detectives. They're the Sherlock Holmes of medicine. They search for the source of disease in a person's medical history. This search includes emotional distress as well. So, what causes fibromyalgia? Fibromyalgia, as we know, is a long-term condition that causes pain all over the body. As far as the medical profession is concerned, the exact cause of fibromyalgia is unknown, but it is probably related to abnormal levels of certain chemicals in the brain and changes in the way the central nervous system, that is the brain, spinal cord, and nerves, processes pain messages carried around the body. It could also develop due to certain genes inherited from parents. Usually, the condition appears to be triggered by a physically or emotionally stressful event, such as an injury or infection. Giving birth, having an operation, the breakdown of a relationship, the death of a loved one. So what causes chronic fatigue syndrome then? Chronic fatigue syndrome, known also as encephalomyelitis, myalgic encephalitis, or ME, is a long-term condition. There are a wide range of symptoms, the most common of which is extreme tiredness. Again, with chronic fatigue syndrome, the medical profession do not know exactly what causes the symptoms, but they believe it may be triggered by an infection or certain other factors. For instance, viral infections such as influenza or glandular fever, bacterial infections such as pneumonia, problems with the immune system, a hormone imbalance, your genes. Chronic fatigue syndrome seems to be more common in some families. As mentioned earlier, the classical homeopath looks at the whole individual, not just the diagnostic. A diagnosis will help, of course, as a guide as to what general symptoms will be there. It can act as a pointer to possible causation, but the overall symptomology as the patient presents, including marked symptoms in the medical history, are the beacons to prescribe on. These symptoms are a sign that the organism is trying to heal itself. The correct homeopathic remedy is a booster to health, much like a leg up on a ladder. Remember, homeopathy treats the person, not the disease. All the symptoms are taken into consideration, like, for example, the physical ones, the emotional ones, the medical history, and general lifestyle. We also look at any strange, rare, or peculiar symptoms and what we call keynotes. Every individual is unique. So what can homeopathy do for fibromyalgia? Homeopathy has quite a good record in managing fibromyalgia. It can relieve symptoms like aches and pains when other methods fail. A homeopath will want to gradually decrease any prescription drugs, like antidepressants, sleeping pills, or painkillers. This will be done alongside careful homeopathic prescribing. If possible, conventional medications are stopped. Those with fibromyalgia have their own special pattern of symptoms and dynamics, their own way of coping. This is where classical homeopathy can help. We focus on individualization when we choose a remedy. In the homeopath repertoire, like the Vitokus Compass software, for example, there are 83 medicines for wandering pain and 45 medicines for muscle pain. So you can see why the homeopath concentrates on tailoring the medicine for each individual patient. Remember that a remedy is only homeopathic when its proven symptoms match those symptoms of the patient being treated. It is unusual to find someone with only the symptoms of fibromyalgia. Most people are struggling with multiple diagnoses as well. But there is a benefit to classical homeopathic treatment. The similimum has the potential of helping to alleviate or even cure other symptoms while addressing the fibromyalgia at the same time. So what can homeopathy do for chronic fatigue syndrome? Chronic fatigue syndrome is not easy to treat, and an instant cure cannot be promised. There are hundreds of remedies for weakness and fatigue, hundreds of them. And a homeopath must gather a lot of information to disentangle the right remedy. In the Vitokus Compass software, there are 357 medicines for weakness, 154 medicines for lassitude, 146 medicines for weariness. Yes, so many. It is also important that a doctor has already been consulted to exclude any serious illnesses that chronic fatigue syndrome may mimic. On the positive side, even if a complete cure may not be possible, alleviation of symptoms can happen after correct homeopathic treatment. Again, a homeopath will want to gradually decrease any antidepressants, sleeping pills, or painkillers being taken during homeopathic prescribing, and then stop conventional medications if possible. Once a diagnosis of chronic fatigue syndrome has been made, it is important to take a full homeopathic history. The emphasis should be on what is individual and special about symptoms. The common symptoms for ME or CFS are taken into consideration, of course, but specific feelings that are different for each individual are important, like, for instance, the sensations felt in muscles, for example, trembling or jerky, or the type of headaches experienced, for example, what side of the head does it hurt, whether the head pain extends somewhere else, like down the back of the neck or into the face, or what side of the throat is affected, and so on. When treating both chronic fatigue syndrome and fibromyalgia, general symptoms, physical and mental, and what homeopaths call modalities are all important. For instance, the homeopath will look for reactions to different weather changes, like the rain, thunderstorm, fog. They'll look for reactions to different room temperatures, like those who need the windows open or they need them closed. They'll look for reactions to weather temperatures, like how are they in heat waves, or what happens when it snows. They will look for the best or worst time of day, like late afternoon, early morning, midnight. Or they'll look for food cravings, like some people like unripe sour fruit, or some crave salt. And they'll look for food aversion, like onion or pork. You see, every person is very different, even if their diagnosis is the same. Particular note should be taken of any conventional treatment given either during acute illness or during the original causation of the chronic fatigue syndrome. Choosing the correct medicine will usually take time and consideration with both the homeopath and the patient being prepared to try more than one homeopathic remedy if there is no result with the first. As they say, the patient must be patient. So the aim of homeopathy is not only to treat chronic fatigue syndrome, but to address its underlying cause and the individual susceptibility, all of which brings us back to causation. Ideally, to access the most reliable source of individualized remedy selection and treatment, those with chronic fatigue syndrome should consult a qualified classical homeopath. I trust now that you are familiar with words that are associated with and indicate classical homeopathy. And yes, homeopathy may indeed regenerate, provided you have a vital force, of course. You are given the similimum, that is a genuine homeopathic remedy. You are given only one dose at a time, the minimum dose, and you are given a single remedy, not a combination. And most important, the degree of regeneration will depend on your level of health. Don't expect to run before you can walk. I will conclude this evening's talk with an excerpt from an article by Kim Ridley, which appeared in Ode magazine issue 30, and which is published on the Vitalkis website. Quote, Valerie Ohanian was a graduate student at the University of Minnesota in the late 1970s when severe fatigue descended out of nowhere. Suddenly, she couldn't stay up for more than 15 minutes at a time without feeling exhausted. Ohanian consulted several doctors, one of whom suggested she might just be depressed and referred her to a psychologist. The psychologist told her she definitely had a health problem. Nothing Ohanian's doctors prescribed alleviated her fatigue and painfully swollen glands. She suffered through the mysterious illness for 2 years, unable to work. I didn't know if I'd ever get over it, she said. I was really willing to try something different at that point. A chiropractor who gave her acupuncture provided some relief, but Ohanian always relapsed in a few days. The chiropractor told me, I think the only thing that will help you is homeopathy. I remembered reading about it and I contacted the only person in Minnesota at that time who was practicing, Ohanian says. After taking the curious vivas, the remedy this fella gave me, I didn't feel anything for a few days. Then one day I realized I had been up doing things for 3 hours, and I was able to stay up all day. Within a month, I had my energy back. Treating conditions such as chronic fatigue syndrome and fibromyalgia can vary, depending on the level of health. Some cases can be cured with just 2 or 3 remedies. If the condition is treated in the early stages, the outcome may be quite successful, but some chronic conditions are very hard to treat, especially if they've been there for 20 years or more. Homeopathy is not a cure-all. I will now draw this virtual talk to a close. I hope you have gained a little more knowledge about how this remarkable medicine, classical homeopathy, can regenerate. If you wish to know more about the areas of scientific research into homeopathy, or you would like to study homeopathy for yourself, or if you have any further questions to ask me, I have posted contact details on my website, the fabulous e-learning program in classical homeopathy, and hundreds of published cases of scientific research in classical homeopathy in the chat box. Thank you, ladies and gentlemen, for listening to me this evening. And finally, thank you, Dr. Neha Sharma. Good evening.